Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Dr. Thomas Grove, how are you today?
Hey, birthday boy. You still celebrating?
Right. I'm 21. Take me out for a drink, huh?
Hey, that's right, Doc. That's right. Birthday week this week.
Yeah, I'm living it up, man. Another trip around the sun. I'd love it. I love the space travel. Anyway, today we're going to talk about how to regenerate tissue in the body. It's a miraculous type of a treatment. It's called regenerative medicine. And what we do is we actually stimulate the body to heal itself. So if you have any kind of pain in your body that has to do with the musculoskeletal system, that's orthopedics, that means your joints, your tendons, your ligaments, all these syndromes from gamekeeper's thumb. What other kind of syndromes? Plantar fasciitis, arthritis.
Achilles tendons, arthritis, muscle strains, ligament strains, any ache or pain in the musculoskeletal system.
You're good at all these names. What are some of these weird names like gamekeeper's thumb?
Gamekeeper's thumb. We had a patient yesterday, de Quervain's tendinovitis. That's a fun one.
Yeah,
right?
It is.
Fancy terms for, inflammation of damaged tissue in the body. We just like to complicate things in medicine sometimes.
And while you guys are listening, pull up your computer and go on Google. And when we say a term, spell it out on Google, and it'll come up. And then in the upper left-hand corner, you can click on images, and you can actually see what these things are that we're talking about. And if you have a syndrome that you have, a type of arthritis, something maybe like a labral tear in the hip or the shoulder, rotator cuff tear, put those terms in and then click images in the upper left-hand corner, and you can actually see what might actually be going on with you. And I say might because typically diagnoses that come into our office with patients, either by imaging of MRI, X-ray, CT scan, or the doctor deciding, are often wrong, and we'll get into that in a second. First, we want to give out our phone number so Dr. Grove and I can have fun with you by you calling in and talking about what things are bothering your body in the musculoskeletal orthopedic realm, or your friends, your family, your parents. Don't be shy. You don't have to give your real name. And give us a call, 866-870-5752. That's 866-870-5752. And you can also, if you want to get a free phone consult with our staff, call our office. They're by the phones right now. That's 800-300-9300. The office phone number, once again, get ready, 800-300-9300. And if you want to watch these procedures of us injecting patients, you can go to the website. That's www.JointRehab.com. JointRehab.com, and you'll see tons of different videos. There's more information on that website that you can rely on than anywhere else in the world. Be careful when you go to Google and look this stuff up. You're going to get a lot of bad information from other people who don't do as much as we do. We probably do more than anybody on the planet. This is what we do all day long. So, what was the term I stopped with, and then I forgot what it was? Oh, something about the diagnosis. and what we do with that. How many times, Dr. Grove, do you have patients come in with a diagnosis that's absolutely wrong?
Yeah, large majority of the time. Imaging can be really useful for us, but at the end of the day, we've got to make sure we're using our hands, right? Using our brains, seeing the picture that's actually in front of us. So I had a patient yesterday really concerned about a disc bulge in their back. Hey, I've got this image. I know it's my disc. It's my L3 disc. But when you do a physical exam, the symptoms don't line up. Their issue is actually something called the iliolumbar ligament. It's a ligament that attaches a bone to a bone from the lower back down to the pelvis. Very common target for people to have, a strained back. So this is somebody who's considering a major surgery that, hopefully we can get taken care of without going underneath the knife.
So we have to be really, really careful with that. And you guys listening have to be really careful too, because very often you'll get a diagnosis that's going to scare you into a surgery. You think the surgery is the answer. And what we find in our clinic is that, obviously people who come to us have had a problem. And if it's a surgery, they had a problem with the surgery. It's called a failed surgery or failed back syndrome, failed something or other.
And Doc, it looks like we got a call here coming in here with Victor from Huntington Beach.
Take a call here for yourself there, Dr. Grove, about his
Victor,
hip and shoulder.
Good morning to you, sir. Dr. Grove and Dr. Darrow here. How can we help you?
Good morning. Good morning. Great to hear you guys on the radio. We've been at your facility a couple times and has had great success.
Good. Thank you.
We're down here in Orange County, and both my wife and daughter have had some hip issues and shoulder issues. My wife even broke her shoulders about 6 months ago.
Wow.
And it luckily healed okay. Didn't have to have any surgery. But just in talking with the orthopedics, I always love to say, "Oh, well, do you do PRP?" Oh, yeah. Gosh. I says, "Oh, do you use an ultrasound?" He says, "No, I don't need that. I've done thousands of them. I know where I'm going." He got real defensive. I just wanted to emphasize that to you guys and all your listeners, that when you say go to the guy that does it the most, you can't say it any better than that. And that's just really it. We even my daughter was having some therapy on her hip and gets talking, and they scheduled her for one. It was going to be yesterday, and the guy didn't even show up.
What was it going to be yesterday she was going to have?
I'm sorry?
What was it she was going to do yesterday?
Have some PRP on her hip.
Okay. Got to be real careful because that hip joint's pretty deep. And there's basically no way. Yeah, there's basically no way to get in there without an ultrasound or a fluoroscopy.
Yeah.
But you don't need fluoroscopy and X-ray, damage to the body. Ultrasound, you can explain what that is, Dr. Grove. There's no negative side effects to it. It's just like looking inside the tissue.
Yeah, so you're looking at radiation. That's what we're discussing here. So things like CTs and X-rays, fluoroscopy. There's a lot of radiation involved there. My big issue with those, I'm trying how to use those as well. They're really good for when you're doing orthopedic surgery and you're looking for how bones are lining up, certainly. But for soft tissue, really ultrasound is the way to go. It's non-radiating. It's much higher definition. You can actually see through soft tissue, so you get a really good three-dimensional representation of what that tissue looks like. But yeah, if you're doing a hip injection without ultrasound, in my honest opinion, that's pretty dangerous. Okay, so back in my internal medicine days when we're doing central lines, right? You've got the femoral artery that sits very close to that hip joint. Every time that I'm doing a hip, I'm always making sure that I'm finding those, those big landmines, so to speak, right? That's not something you want to be poking around with a needle. It could cause a lot of issues there. So yeah, that's a dangerous move not to use ultrasound, in my honest opinion.
Yeah, in that area of the hip
very
joint,
much so. And these are, I want to name names, but we're talking UCI and Newport Beach down here.
Well, look, Victor, you don't go to us to have a surgery. We were both Dr. Grove and I did tons of surgery. We loved it, but we're not doing that now. You don't come to us to do a surgery, and you don't go to an orthopedic surgeon to do regenerative medicine of PRP and stem cells. That's ridiculous.
Exactly.
Because if they're doing surgery, that's where their time goes, and that's their love. And they're not real believers in my experience in regenerative medicine. I have a lot of orthopedic surgeon buddies, and we scream at each other because I tell them they're hurting people, and they tell me I'm not doing any good. And I go, how do you know I'm not doing any good? And they say, well, I tried it a few times, and it didn't work. And regenerative medicine with stem cells and platelets is not something you try. It's something you do until the tissue comes back. It may need more than one treatment. We never know ahead of time. We can't project that. I've had terrible arthritis with patients who have healed basically overnight. How did that happen? I don't know. I really don't. Sometimes I think it might be the inflammation that we create that separates the joint and then gives it a chance to heal. A lot of possibilities of what's going on. What I do know is that what we do is very safe. We don't have terrible outcomes.
Absolutely, and it worked on Maria. So you did her hip a couple of years ago, and it was night and day. You did the stem cell on her.
Who's got the shoulder issue? Your wife after the fracture?
That's Maria also, yeah. But
right. Well, here's something that we find.
It healed fine, but I'm sure the ligaments have been through some problems.
Well, that's really smart of you, Victor, because what happens is when a bone is fractured, the bone typically heals pretty good, not all the time. Dr. Grove, do you know the percentage of healing with fractures? It's probably pretty high.
Yeah, so bones heal a little bit different than soft tissue, so they tend to heal a lot better on their own.
But what happens often is the soft tissue around the bone, let's say someone fractures the shoulder like Maria did, the tendons get stretched at the same time, and they can create what's called an enthesopathy, which is where the connection of the tendon ligament to the bone is irritable. And that's where we can get in there, and with the ultrasound, we can actually see that spot down to how small, a millimeter?
I mean, less than a millimeter. Yeah, it's really, really small. And there's all these supportive structures around something. So if you think about, you have a big fall, and we see this a lot more with, dislocations and fractures, right? So the bone might heal, like Doc said, but the stuff around it, right? So just because the bone's healed, we still have a lot of people with chronic pain after injuries like that. And that's what we think is going on is, okay, maybe it's the soft tissues, maybe it's the supportive structures around that area that, quote unquote, on imaging is healed, but you still have pain.
I'm going to give out the phone number, Victor, so we can get some other callers. So hang with us. If you want to talk to us live right now, Dr. Grove, Dr. Marc Darrow, you can call us live right now. Victor, give us 1 second. I'll give out the phone number. That's 866-870-5752. Give us a call. We love our callers. It's so much fun. And Victor, thank you so much for calling in. Any other issues you can think of, Victor, or any other information you have for us?
I was wondering if Dr. Grove have heard why the hippie couldn't be saved by the lifeguard.
Why could the hippie not be saved? I don't know. Hit me with it. What do you got?
He was too far out, man.
Victor, we like you. You're a good man. Thank you so much. All right, God bless you, Victor.
Real soon, Mark.
All right, we're going to go on to some other things and some questions. So give us a buzz right now, 866-870-5752. And if you want to call the studio, if you want to call, that is the studio. If you want to call the office, the phone number there is 800-300-9300. If you want to watch videos of us doing these procedures online, go to the website, which is www.jointrehab.com. Our website has every page with a spot for you to email us to. We answer emails all day long. I wake up and I do emails. I go to sleep and I do emails. And I love communicating with people. We get emails from all over the world 24 hours a day, and it's a lot of fun to hear from people having so many different things. And there are times we don't even know what it is that's going on. And we had a woman yesterday that was very complex, the 78-year-old woman who flew in from New York.
Sure.
And it's pretty interesting. She had a lot of what I'll call constitutional issues, things that are not related to her orthopedic issues. She came in with issues about her hands hurting, and the doctors didn't know what it was. So we went through the whole bevy of things. Susan, you hang on there. We'll be with you in a second about your son. So we went very thoroughly, and our what's called a problem list was about 10 things long. It could have been rheumatological, could have been autoimmune, it could have been a nerve impingement in the neck or carpal tunnel syndrome, it could have been arthritis, it could have been so many things. And so what Dr. Grove is, he pulled out his magic wand, which is called the ultrasound. What'd you find?
Yeah, so for her, very classic scenario where she has some thumb arthritis and called the basal joint or the carpal metacarpal joint, has some inflammation in some tendons around that thumb called de Quervain's tendinosynovitis. So a couple of things going on. But again, when you're looking at, the whole body, you got to be holistic, right? You got to be conservative, you got to be holistic. So looking at things like, hey, maybe we need to take a peek at some labs, see if there's something else that's going on, and look at to provide the best quality care for somebody.
Yeah, I'm thinking we must have spent at least 2 hours with her.
Oh, a couple hours. Yeah, sure.
Because she was
Easy.
a complex woman, and getting on an age for her. So we thought about things about gait training, which is fall and recovery, which means if you fall, you can die. You can fracture a hip, but you can't get up sometimes. And a lot of people die in their kitchen just because they fell down. They don't know how to get back up to get to the phone to call someone for help. And then we were thinking of so many other things, getting a blood test to check her vitamins, minerals, antioxidants, things of that nature, which is called SpectraCell. It's a test we can do in the office to see if her feelings in her hands and her feet, she was having pain in her hands and feet, was from a peripheral neuropathy, because we looked at her labs and her hemoglobin A1C was 6.2 and her glucose was 148. She's got diabetes. That causes peripheral neuropathy. She's a very complex woman in terms of what her medical issues are. We didn't just go for the orthopedics. We go for the healing of the entire person, what we call holistic healing. So when you come to us, we do a look-through for everything that's going on. So, Dr. Grove, you want to talk to Susan, who's waiting right now?
Yeah, we got Susan coming in from L.A. Susan, are you with us?
Susan, can you hear us?
Susan, can you hear us over there?
Hear you.
All right, good.
I can hear you.
There we go. Susan, good morning to you.
What's going on?
Good morning.
Nice to meet you, Susan. This is Dr. Marc Darrow and Dr. Thomas
Hi,
Grove.
Dr. Marc.
How are you feeling today?
I'm feeling okay. Just looking for answers, and I listen to your show pretty frequently, so I was just curious if you can help me through this and give me some guidance.
Sure.
So my son, who's 30 years old, was just diagnosed with MS, and I've heard about stem cell therapy. I don't know if it works for MS, or is there any way to fix the myelin that's already been attacked?
Okay, so we're talking about a diagnosis right now, and we have to be careful.
Correct.
That's right. I've had a lot of people come in who have said they have multiple sclerosis, and they did not. Mm-hmm. Doctors like to give diagnoses. In order for insurance to pay for what they're doing, they need a diagnosis. So there's a lot of made-up diagnoses. I'm going to ask you what his symptoms are. How do you know he has multiple sclerosis?
Well, they did the scan of his brain and his spinal cord.
Okay.
And they see the lesions.
Okay.
I took him to 2 MS specialist neurologists.
Good.
Because I didn't believe it.
That's not his symptoms. What are his personal symptoms? What does he tell you?
Okay, so his symptoms, he says that he feels that the right side of his body feels off, that he doesn't feel connected.
Okay.
And he just feels that his whole right side of his body is not as strong and responsive, but he doesn't feel, because they always ask him, do you feel any tingling or numbness?
Yeah. Mm-hmm.
And he says no.
Does he have any tremors?
Not that I'm aware of, no.
Okay. Does he do sports?
A little bit. I mean, he loves to play soccer, but he really hasn't been that active with sports. I mean, he works out, he runs.
Okay. Well, I'm just going to say this. I don't know a darn thing about your son, So what I'm saying, take with a grain of salt, but listen to it. We don't know that that means because there's plaques in the spinal cord or brain that he actually has multiple sclerosis. And the most important thing is not the name of the diagnosis, but how does the person feel? From what you're telling me, your son doesn't feel terrible, and he's still doing sports. He's still working out. So he may actually not have multiple sclerosis. Do you understand what I'm trying to tell you?
Right. So then how do you figure this out? Because these are the two biggest MS specialists in Los Angeles. So I don't know what.
Well, the point is this. Let's pretend he has it, and then let's pretend he doesn't have it. Okay? Let's pretend both things.
Okay.
I call this running it up the flagpole to take a look. All right? You look at all things in any issue. That means you're open-minded, and you're open to healing, and you're open to all kinds of things. And if it is MS, there are things that can be done naturally also. And one of them is an alkaline diet. All right? That means you get rid of the acid in the body. So you can write that down, alkaline.
Yes, I did. Alkaline diet. So because they're all
high, and then high level
Mediterranean diet.
Okay, well, that could be all the same. You know, you have to gauge it the way you want to gauge it. Nobody knows the perfect thing for healing in this world. You try different things, all right, and you see what works. Mm-hmm. What works for one human being will not work for another necessarily. They haven't put him on a medication yet?
No, he just recently signed up to start the medication.
Okay. All right. Well, see, these are all personal decisions, what you're going to do. I know for myself, I don't feel perfect. And I don't want to find out a diagnosis. I injure myself all the time in sports. I don't get MRIs. I don't want to know because most things heal up. How long has your son been feeling like this?
He started noticing it in March. We were traveling, and then he told me he doesn't feel well, and then he came back.
Okay, where were you traveling? Out of the country or here?
No, we just flew to New York. But then when he did some panels, they realized that his testosterone level had dropped increasingly low. He was down to like 200. Okay, and has that been replaced yet? I'm sorry?
Is he replacing his testosterone now?
Well, then the doctor said, you know what, it could be like some kind of a viral infection. Let's just wait. Let's give it a month and see what happens.
Yeah.
And within the month, his levels went back up. So I think he's now back up to like
good.
400 or 500. Yeah. His levels went back up.
Okay, so write this down. His level of 400 or 500 means zero. That doesn't mean a thing. What matters is the level of his dihydrotestosterone, DHT.
Uh-huh.
The reason is the testosterone total is protein bound. That means that it's locked up in little prisons, you might say. It's not active. So the DHT has to be checked. His estrogen should be checked. There's a lot of things. His growth hormone should be checked. There's a lot of things going on. And the fact that he had some kind of an insult like that to his body might even give more evidence that this is not MS.
So would you be able, if I bring him to you, would you be able to identify this?
I'm not sure. There's a lot of things we can't identify. There's a lot of things that happen to people that no one ever knows what it was, and then sometimes it goes away.
But if the MRI and the spinal MRI shows lesions, it doesn't necessarily mean that it's MS?
No, it doesn't. It's extra information. If your son, there are people, look at it like this, Susan. Your son didn't get those lesions in March.
No, he did not.
So a lot of people walk around with lesions and they never know they had anything. It's like arthritis. There's a lot of people that have arthritis that have no pain, so they never go to a doctor, never find out that they have arthritis. Anyway, I don't have the answer. I'm just saying, the bottom line for this is if he wants to try that medicine, he can take it. But if it doesn't do any good, get off of it. Too many people take too many medicines they don't need. Hang with us. We're going to go to a break. And if you want to get a free copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, call in 866-870-5752. We want to talk to you.
You're listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.